So what if I told you that a proposal, meant to make a routine pediatric appointment feel safer could actually end up costing almost $8 billion?
I mean, it sounds totally backwards,
Right.
but that is exactly the very real mathematical cliff we're kind of staring at today.
Yeah, so welcome to this deep dive. We're calling this one Three Needles and a Myth.
Which is a great title, by the way.
Thank you. Today we are digging into a current proposal out there to replace the combined MMR vaccine. So that's the standard shot for measles, mumps, and rubella with three completely separate injections.
Right, which potentially means three completely separate medical visits.
Exactly. And our mission today is to ask the really critical question here. Does separating the MMR offer any genuine safety benefit for you and your family? Or does it just add delays, these astronomical costs, and leave kids entirely unprotected?
And to get to the bottom of that, we really need to look at the sort of silent window of time between that first hypothetical injection and the final appointment.
Because a lot of life happens in that gap.
Oh, absolutely it does.
I mean, let's just picture the reality for a second.
Wow.
Anyone who has ever, wrangled a toddler into a car seat, circled the block looking for parking at a busy clinic, sat in a waiting room filled with coughing kids, going through that whole crinkly paper exam table routine.
It's a lot.
It's a logistical marathon for just one visit. And now we're talking about multiplying that entire ordeal by 3.
Right, which completely changes the landscape of healthcare access.
Yeah.
But before we get into the modern data and the logistics of all those extra visits, we have to address the elephant in the room.
Yeah, we do.
Like, where did the idea to split this highly effective, decades-old combined shot even come from in the first place?
I'm really glad you brought that up because policies like this, they don't just, materialize out of thin air.
No, they
Not
certainly
really.
don't. The spark of this specific fear traces back to a 1998 report published in the medical journal The Lancet. And that report suggested a link between the combined MMR vaccine and autism. But, and let's be absolutely unequivocal right at the top here, that 1998 paper has been entirely retracted.
Right.
And it is thoroughly, completely discredited by the global medical community.
So it's simply not accepted science. But,
Yeah.
okay, let's unpack this for a second because this is the thing that always trips me up when looking at the history.
Yeah.
How did a study that small, because what was it, a sample size of just 12 kids?
Yes, literally just 12 children.
Right. So how does a study of 12 kids trigger a global, decades-long panic? I mean, if the methodology was that weak, why did doctors and the media even let it gain such massive traction?
Well, you have to look at the environment of the late 90s. The internet was just starting to, democratize medical information,
Right.
but we didn't have the fact-checking infrastructure we try to rely on today.
Oh, that makes sense.
And this claim, it touched on something deeply primal, right? Parental protection.
Of course.
If a doctor in a white coat at a major London hospital holds a press conference saying there might be a hidden danger to your child, I mean, the media runs with it. They love a David and Goliath story.
Yeah, they really do.
And the scientific community takes years to run the massive replication studies required to actually disprove a claim. But a terrifying headline moves at the speed of light.
It really does. And, we should be really clear here, too. The parents who got caught up in this, both then and now, they are just trying to do what's best for their kids.
Absolutely.
The intention is pure love and protection. So we are challenging the misinformation itself, never the parents who are just trying to navigate this chaotic information landscape.
That is such a vital distinction.
And we also need to be really careful with how we talk about autism, right? It's a neurological variation. It's not some terrible tragedy or harm. The fear-mongering of that era often framed it in this incredibly harmful, pathologizing way.
Right, exactly. The panic was manufactured by the claim of a cause, not by the reality of autistic individuals. But because that panic took root, people started looking for compromises.
Right, like finding a middle ground.
Exactly. And one proposed solution was to break the vaccine up. Give the measles component, wait a few months. Give mumps, wait again. Give rubella.
So if a discredited study of 12 kids started the myth, what does the actual population-level data say about the safety of the combined vaccine today?
Well, the scale of the follow-up research is just staggering. To see what the data actually says, we can look at a monumental Danish cohort study published by Hvide and colleagues, and this was in 2019.
Okay, so pretty recent.
Yes. And in stark contrast to 12 children, this study followed 657,461 Danish children.
Wow. Over 650,000 kids. I mean, that is a massive leap.
It is. and they follow them over 5 million person years.
Okay, wait. I want to pause on that term really quick. 5 million person years. Because it pops up in epidemiology a lot, but it can sound, a bit abstract.
Sure.
What does that actually mean in practice?
It's really just a way to measure observed time across a massive group. So if you track one person's health for a year, that's one person year.
Right.
If you track 100,000 people for 10 years, that's a million person years. So in this case, tracking over 650,000 kids for various lengths of their childhood added up to 5 million years of human life observed.
Oh, wow. That makes total sense.
Yeah, it gives the study immense statistical power.
Yeah.
And Denmark is uniquely positioned for this because of their incredible national health registries. They can link a child's vaccination record directly with any later medical diagnoses, sibling history, environmental factors, you name it.
So they basically had this crystal clear long-term view of a huge population.
Exactly.
So what did the numbers actually show?
Well, they calculated what they call an adjusted autism hazard ratio. Basically, they compared the kids who got the combined MMR to kids who were completely unvaccinated.
Okay.
And the hazard ratio came out to 0.93.
Okay, so I know a ratio of 1.0 would mean there is zero difference in risk between the two groups, right?
Correct.
Does 0.93 mean the vaccinated kids actually had a slightly lower rate?
I mean, mathematically,
Yeah.
yes, it points to a slightly lower rate in that specific data set. But we have to look at the margin of error, which researchers call the confidence interval.
Right, the fine print.
Yeah, they reported a 95% confidence interval of 0.85 to 1.02.
Okay, could you translate that margin of error into plain English for us?
Think of it like throwing a dart. The hazard ratio of 0.93 is exactly where the dart landed on the board, but the confidence interval is the size of the overall target area.
Okay, I'm with you.
Because that target range, 0.85 to 1.02, crosses over the number 1.0, it tells us that the true risk is statistically insignificant.
Ah, I see.
It's clustered so tightly around no effect that any microscopic fluctuation is just statistical noise.
So it's essentially a flat line, zero increased risk.
Exactly.
But, I've watched the arguments around this evolve over the years. When the massive population studies didn't show a link, the goalposts moved.
Right, they always do.
People started saying, well, maybe it doesn't cause it in everyone. But what about susceptible subgroups? Like, what about kids who are genetically predisposed? Did this Danish study address those moving goalposts?
What's fascinating here is that this was actually one of the most rigorous parts of their research.
Yeah.
They didn't just look at the broad average. They specifically tested those subgroups.
Oh, really?
Yeah, they looked at children who had siblings with autism, which we know increases genetic likelihood. They even built a disease risk score based on environmental factors like parental age and birth weight.
And did they find anything hidden in those high-risk groups?
Nothing. Zero increased risk anywhere. Not in the kids with autistic siblings and not in the high-risk score groups.
Wow.
They even looked for temporal clustering, meaning did symptoms suddenly spike in the specific weeks immediately after the shot was given?
Right, looking for an immediate trigger.
Exactly, and the risk was completely flat across the board.
We should probably throw a quick caveat in here just to explain how science works. This was an observational registry study focused specifically on the MMR vaccine and autism.
Yes.
It wasn't designed to answer every single question about vaccines ever asked in human history.
No, of course not.
But for this central myth, does the combined MMR cause autism even in susceptible kids? This study is just a data steamroller.
It really is.
Uh.
It leaves no room for doubt on that specific question. The safety rationale for splitting the combined vaccines simply does not exist in the data.
Okay, so with the safety of the combined shot scientifically validated by over 650,000 kids, let's pivot to human behavior.
Let's do it.
Because what actually happens in the real world when parents do have the option to choose 3 separate needles instead of 1, a proposal to split the shots relies entirely on the assumption that people will actually follow through and get all 3.
Right, and to see how that actually plays out, we turn to the United Kingdom. In 2008, a researcher named Anna Pierce and her team published a study looking at 14,578 UK children born between 2000 and 2002.
Just to give us a little context on the UK at that time, were both options available to parents?
Yeah, so the standard combined MMR was the free recommendation provided by the National Health Service. But because the lingering fears from that 1998 paper were still so strong over there, single antigen vaccines were made available privately for an out-of-pocket cost.
And just to clarify the jargon really quick, a single antigen vaccine just means a shot for only one disease at a time, like just measles instead of the combination, right?
Correct. And the uptake numbers from this cohort reveal a really fascinating story about logistics. By age 3, About 88.6% of these kids had received the standard combined MMR.
Okay, so the vast majority.
Yes. But a small slice, about 5.2%, went the alternative route and received at least one single antigen vaccine.
So what happened to that 5.2%? Like, did they eventually get all 3 shots and reach full protection?
This is where the policy completely falls apart in practice. Of the children who started the single vaccine route, only 52% actually received all 3 components.
Wait, are you saying nearly half of the kids who chose this separate route never finished the course? They
Yeah.
just stayed vulnerable?
Yes, exactly. 37% got measles and rubella,
Yeah.
but entirely skipped mumps. And some only ever got the measles shot.
That is just wild to think about. It kind of reminds me of buying a massive complex puzzle.
How so?
Well, it sounds so manageable when you're holding the box in the store. You think, I'll just put down one piece this month and another piece next month.
Right.
But then real life hits. Your toddler spikes a fever on the morning of the second appointment. Your boss refuses to give you another afternoon off work. The car gets a flat tire.
Yep. Life gets in the way.
Exactly. So you stop at piece 1, and the picture remains completely unfinished.
That friction is exactly what public health officials lose sleep over. Every additional appointment you add to a medical schedule is a drop-off point. It's an opportunity for someone to fall through the cracks.
Yeah.
And this UK study highlighted exactly who was able to overcome that friction. The mothers who successfully navigated the single vaccine route and got all 3 shots tended to be wealthier, older, and more highly educated.
Which unfortunately makes total sense. Navigating a complex multi-visit medical schedule takes a massive amount of privilege.
It really does.
You need a highly flexible job, reliable transportation, and in this specific UK scenario, the disposable income to pay private clinic fees.
Exactly. By mandating 3 shots, you are creating a structural barrier. When a medical intervention requires more time and resources from the patient, coverage inevitably drops, and it drops unevenly across socioeconomic lines.
Yeah, we should be careful to point out that this study found associations, right?
Yes, very important to note.
It's not absolute definitive proof in a vacuum that the single vaccines were the sole cause of the lower coverage. There are always complex confounding factors in human behavior, but the correlation with logistical drop-off is glaring.
It is a very strong observational association. When you require 3 visits instead of 1, for nearly half the kids in that group, it meant they remained vulnerable to at least one preventable disease.
So it's splitting the vaccine causes this logistical drop-off. What does that actually mean for a country at large? Because a few kids missing a mumps shot in one town doesn't sound like a national emergency.
To see the macro effect of that, we have to bring things right up to the present day. There is a fascinating 2026 study by Wells and colleagues published in the journal PNAS that modeled exactly this scenario for the United States.
Oh, interesting.
Yeah, they wanted to show how seemingly small changes in coverage create massive nonlinear effects across a population.
You know, I think about population immunity kind of like a dense, healthy forest.
Oh, I like that.
Yeah, the vaccinated people are the fire breaks areas cleared of brush so a fire can't spread. A 1% drop in vaccination coverage is like removing just a few of those fire breaks.
Right.
You look at the forest and think, well, it's still 94% protected. We're totally fine. But suddenly a spark, which in this case is, say, a case of measles imported from international travel, can jump those gaps.
Yes.
Because the fire breaks are gone, the fire doesn't just burn one tree, it can burn down the whole forest.
That is the perfect metaphor to understand the threat here. Measles is one of the most highly contagious viruses known to humanity. It requires an incredibly high threshold of population immunity, around 95%, just to stop transmission.
Wow, 95%.
Yeah, if you dip below that, the fire jumps the gap. So in this 2026 study, the researchers modeled a very specific scenario. What if there is a mere 1 percentage point annual reduction in MMR coverage among young children, aged 0 to 6, over a 5-year period?
Just a 1% drop a year? What does the math say that does by the year 2030?
The model projects that this scenario would result in about 17,232 measles cases.
Wow, I mean, we have effectively eliminated endemic measles in the U.S., haven't we?
We have. Endemic just means the disease is constantly circulating locally. Right now, almost all U.S. cases are sparked by someone traveling abroad, catching it, and bringing it back.
Into an under-vaccinated pocket.
Exactly. But with this projected drop in coverage, we wouldn't just have isolated pockets, we'd have massive interconnected vulnerabilities.
So out of those 17,000 projected cases, what is the human cost?
The researchers estimate 4,085 hospitalizations.
That is a massive strain on pediatric intensive care units.
It is. And tragically, they project 36 deaths.
That is heartbreaking. And then there is the economic side of the equation. I know you had a number for the financial toll. What did the model project there?
A cumulative 5-year cost of $7.77 billion.
Almost $8 billion. Where on earth is that money going? Is it all just hospital bills for the patients?
Not even close. The largest chunk, about 65% of that $8 billion, goes to public outbreak response.
Where? Really?
Yeah, measles is airborne and can linger in a room for up to 2 hours after an infected person leaves. Imagine a child with measles sits in a crowded emergency room waiting area.
Oh, wow. So public health officials have to find every single person who breathed that air.
Yes. They have to execute intense contact tracing. They have to track down everyone who is in that airspace, verify their immune status, enforce quarantines, administer post-exposure vaccines.
That sounds exhausting.
It requires an absolute army of public health workers, and it is incredibly labor-intensive.
So what makes up the rest of the cost then?
About 32% comes from productivity losses. This means parents missing weeks of work to care for sick kids or to quarantine themselves, kids missing school, and just the ripple effects on the local economy.
So the actual direct medical bills make up a surprisingly small fraction of the damage.
Exactly.
Now, here's where it gets really interesting, and we need to put a giant asterisk on this section. This 2026 study is a mathematical scenario based on data. It is not a guaranteed crystal ball forecast of the future, and it is not a direct simulation of this specific split vaccine policy. It's basically an exploration of what happens if coverage drops by a small amount.
That is a crucial distinction, but it perfectly illustrates a foundational law of epidemiology. You cannot have a small measles outbreak in an under-vaccinated population.
The math just doesn't allow it.
The nonlinear transmission dynamics simply do not allow it. If splitting the shot causes even a modest logistical drop-off like we saw in the UK, the mathematical reality of measles means we pay a catastrophic price in both health and dollars.
So what does this all mean? Let's pull all these threads together. We've looked at the history, the registry data from Europe, and the economic models here in the US. How do we synthesize these puzzle pieces for you, the listener?
Well, when we look at these 3 pillars of evidence, a very clear picture emerges. First, the autism evidence, that massive Danish study of over 650,000 kids, does not support the safety rationale for splitting the MMR. The risk of autism from the combined vaccine is 0.
Okay, that's one.
Second, the historical data, the UK study, proves that access to single vaccines does not automatically equal complete protection. Logistics get in the way, and kids are left vulnerable.
And 3.
Third, the U.S. 2026 economic modeling shows that even tiny drops in coverage, the exact kind of drops caused by those logistical hurdles, have catastrophic health and economic consequences.
Just to be incredibly precise on the medical terminology before we wrap up, throughout this deep dive, we've been talking about the standard MMR vaccine, measles, mumps, and rubella.
Yes.
There is another formulation out there called the MMRV, which includes varicella or chickenpox. That's a different combination, but the core debate today is really about splitting the baseline MMR into its 3 individual components.
That's right. And while no single scientific paper directly tests the exact legislative wording of a proposed U.S. policy to split the vaccine, this complementary evidence gives us a very clear answer.
It really does.
The rationale for splitting it is based on a debunked myth. The logistical execution of splitting it creates a structural barrier, and the consequence of that barrier is the resurgence of deadly diseases.
It brings us to the ultimate takeaway of this deep dive. You know, when we hear the word convenience in public health, we tend to think of it like an amenity, like getting a better parking spot or, you know, a nicer waiting room with better magazines.
But convenience in public health is infrastructure. A single combined injection is a marvel of modern convenience. And that convenience translates directly into high population coverage rates.
Yeah.
It determines whether life-saving protection happens on time or whether it happens at all.
Think about the everyday hurdles in your own life. Getting out the door on a Tuesday morning is hard enough. Finding reliable childcare, trying to take an afternoon off work without losing pay, dealing with traffic.
It's exhausting.
If those normal, everyday things already hinder basic health care, how much hidden danger do we create when policies mandate more complexity for parents? When we take something that works safely in one visit and stretch it into 3.
We build a system where only the most resourced families can survive it,
Mm.
and that leaves everyone else's children vulnerable.
If this deep dive helped clarify the science behind the headlines for you, please subscribe to the channel and like the video so we can keep untangling these complex topics together.
It really allows us to keep bringing you this kind of evidence-based analysis.
Because when it comes to public health, sometimes 3 needles just leave room for a myth to slip in.